I'm really excited today to bring this topic to light. It's one topic that I feel is going to inform people who are either taking care of seniors at home, their parents, other loved ones, and we're going to get some great information from this. So today, again, I have Celina Lloyd, Executive Director of Altia Senior Living. Welcome, Celina.
Glad to be here. Thanks for having me.
So today we're going to be talking about more of a medical topic, but something that is extremely common and can potentially be really dangerous and even fatal for seniors. We're talking about UTIs.
Correct. So most people are unaware of the dangers that UTIs can cause, and they don't realize the effects in the senior population. You know, most people are aware and used to the way it affects us when we're younger. Our senior population is much more susceptible to UTIs. They're much more frequent, and they cause different symptoms.
Do we know what causes that difference as far as like why is it more frequent, or why are they dealing with those issues?
There are several. So malnutrition is a big one. Improper hygiene, that's a big one, especially for those that are living alone.
When you say hygiene, that relates to them not being able to either bathe themselves correctly, or when they have to use toileting, it becomes an issue of like not being able to
So if they
clean
can't
themselves.
properly clean themselves, and if they're not properly bathing or bathing often enough, dehydration is a big one. Urgency and holding it, and that's really common with them. They don't want to, have to go through the trouble that it takes to go to the restroom. So they hold it, and that allows the bacteria to grow. So that's another one. Uncontrolled diabetes, that can cause more frequent UTIs, and poor bladder control. So if they are incontinent and they aren't able to stay dry and stay clean, those are frequent reasons for UTIs.
I want to go back to what you said about holding it, because that's something maybe that most people might not actually recognize.
Right.
But again, when I think of like my grandmother or my grandfather, late at night, if they're incontinent, they want to go to the restroom, they have to go to the restroom. What typically happens in that situation? How do they end up holding it?
Right. So typically they're not holding it at night. They're holding it when they're trying to go to the bank, or they want to go out with their family to eat, because they're usually wearing some type of pull-up or something like that, and it's cumbersome, or buttoning and all that stuff is difficult for them as they age and they have those arthritic hands. But what you were saying is a good point. Getting up at night is extremely common for the geriatric population, our seniors, and it's a danger. They're usually a little bit, not quite out of it. They're still sleeping. If they did not go to sleep with their walker or their cane right next to the bed, then they often forget it and just walk to the bathroom, independently, which they usually aren't. And it's a very common cause for falls, the bathroom at night.
And that's what I was going to state. I know that we all know that typically these falls happen at night when they're trying to navigate themselves to the restroom, maybe without any assistance. So tell us how you do that at Altius. Right. What's the difference there?
So because of our smaller population, our caregivers are going around. They do 1 hour rounds, and so they're checking on the residents every hour. But also, for the ones that have trouble with incontinence, they're getting them up and helping them go to the restroom. And it's such a small environment that they're able to hear them and know if there's a need to go to the restroom. And we have like I said, they can hear them, but also since they're checking on them and asking them if they need to go, because oftentimes they're awake, they know they can't get up out of bed, so they're waiting. And those times that they can
and they're
just
getting full
take them
assistance on that,
and take them and make sure that they're
which prevents
safely,
falls as well.
Exactly.
That's
but
great.
It also prevents UTIs.
Right. So let's talk a little bit about those signs and symptoms. I know that in the senior population or the geriatric population, sometimes, these signs and symptoms are atypical. So talk about that a little bit.
So we all know when we were younger, it's burning, frequency goes up, but that's not the case with the seniors. Oftentimes, it's just confusion, which is hard to point out sometimes. But if you notice a big difference in the way mom or dad are behaving, and they can get their nurse or whatever to check for it, that's often one of the main things that you can see. Hypotension, which is low blood pressure, that's a common symptom of a UTI. Tachycardia, so high heart rate, and their heart rate's up. If there's several of those symptoms going on, that's a possibility. Having a low appetite, that's also a symptom.
Yeah, it's an unusual symptom that most people might not even pick up on.
Exactly. And that's another reason that having them in the smaller residential care environment is a good thing, because the caregivers are going to notice mom didn't eat as much, and they're going to report it. It's going to be in her file. And if the family wants to know those kinds of things, they're going to be letting the family know right away. Also letting the nurses and the doctors know. The nurses that come by, they will be talking to the caregivers, and the caregivers know mom and dad, so they can easily relay that information. Frequent falls, that's a sign of a UTI, and drowsiness. So if mom or dad is all of a sudden agitated or confused and has a fall, possibly UTI.
Yeah, you should suspect that.
Before I worked with seniors, I had no clue. And a couple of times I was working with a resident or a patient of mine doing physical therapy, and they were completely different, completely confused. And I was able to pick up on some of that stuff too. So having all that years of experience helped me a lot too. And all the talking I did with the nurses as well that worked with them helped me to, learn some of this stuff.
Yeah, I think those are really great and important points. My background is in the fire department and EMS. So by the time we would get there, we were dealing with a whole different situation. But it was a culmination of all of those symptoms and all of that happening and it not getting picked up on. So I think that the intervention, if you can get it early, makes all the difference. Because once we're there, we're talking about people who are going into sepsis.
Right.
And sepsis is a really dangerous condition.
Right. Explain a little bit about that for people who don't know.
So sepsis is basically a poisoning of the blood. It's due to infection that's not treated. And given enough time, it can cause death.
Right.
So the symptoms that you mentioned, being altered, the blood pressure, the tachycardia, all of those things can give you clues to that, that's progressing.
Right.
So that's a really important part. Intervening early makes all the difference.
Exactly.
It is going to keep a resident out of the hospital. It's going to potentially
out of the ER.
That's exactly right. That's exactly right. So that's a really great point.
And from falling.
And from falling too, which can cause trauma in that way.
Exactly.
And trauma that sometimes they're going to need, months and months of rehabilitation from. So if
you're able to stop it from the beginning, then you keep the cascade of issues that come from everything else, because it starts as a UTI. It starts as, not hydrating enough.
Well, you mentioned that, not hydrating, which is one of the great things you can do to start preventing some of these things, as well as, being attentive, like you mentioned.
Right.
How do your care partners do that? Do they monitor that in the residents?
Depending on the resident, if measurements need to be done, that is something that we can do. But the main way to keep them hydrated is by giving them options and different ways of staying hydrated. So not everybody likes to just drink water, and water isn't the only way we can hydrate. Giving them juices that have a lot of water in them, or frozen treats that are mainly water. Those things will get them hydrated just as well in a different way. Doesn't always have to be like drink water, mom, drink water.
Sure.
Right, exactly.
Yes.
If we can find alternatives that mom and dad like, then that's what, and we'll be able to remember what it is they like and do those things.
Absolutely. Now, I also know that if they are showing some of these signs and symptoms, or maybe any other kind of medical condition, you've talked about having providers. Now, these are providers that can come into the home.
Right. So every resident and every family has the right to their own caregivers. If they want their own providers, if they have a doctor that they work with, that they want coming, and already visits them at home, they can do that. If they have a home health agency that they like, they can use them. But I also have several physicians, specialists, and home health agencies, as well as hospice agencies that are coming to Altius, and they interact with each other and the house manager and the caregivers to provide continuity of care. And the families can be as involved as they want or not. It's fully functioning, and it's going to cover all their needs. But when the caregiver sees something, is not right with mom, she can contact the house manager. House manager is going to contact the nurse and get the ball rolling to figure out what's going on.
I've been very impressed, and I think after COVID, it's much more of an emphasis on trying to keep the resident at home, out of the ER, and providing those medical services that they need, including up to imaging and labs. So it's all there for you.
Exactly. So most people don't realize that home health is a covered service that Medicare covers. It's covered by insurance. It's at there's no cost out of pocket. And so that 100% coverage, when every penny matters at that age, because they're not, that matters a lot. So it's a good resource for them. But those, the home health agencies, they also provide the, x-rays, like you said. They can draw labs at the, residence. And IVs. There are a few other services that the
It's
home
almost
health
like a full
agencies
service that they
can
can
provide
come and
in the home,
Right.
so that the residents don't have to be leaving. We know it can be taxing for them, so we're trying to keep that at a minimum.
Again, really great information. I think these are resources that need to be out there, that people need to hear. Even if, like I said, they're caring for their own parents at home, these are conditions that are common, and if you can intervene quickly, they can make all the difference.
Right.
So again, Celina, being a resource for this, how can people contact you on this, or how can they find out more about this?
Right. So anybody can give me a call at 972-299-0267 or email me, and check out our website. There's lots of information on it.
That's great. Thank you.
Mm-hmm.